Hello, and welcome to healthing.ca. June is Migraine Awareness Month, and today we're talking to Dr. Elizabeth Leroux, a neurologist and headache specialist based in Montreal, about living with migraines and the support that's available. Dr. Leroux, thank you so much for agreeing to speak to us today. We really appreciate it, and we're really excited to talk to you today about migraines and the impact that a migraine can have on a patient's life.
Yeah, well, it's always a pleasure to chat about migraine because it affects so many people across Canada and the world.
Absolutely. So, what is a migraine and how is it different from a headache?
Yeah, I think the key is that a migraine is an attack. It's a neurological disease first, and it comes with a headache, but with other symptoms. And those symptoms fall into different categories. So there's one that's sensory hypersensitivity. So people are really intolerant or are pained by light, sound, smells, movement. Then the other category is nausea, vomiting, so kind of gastrointestinal symptoms. And then there's like pains in other places than the head, for example, sinuses, the jaw, the neck. And then all that's kind of psychological, cognitive, emotional. So people will describe difficulty to focus, irritability, brain fog. And some people will have even an aura. So it's kind of a storm in the brain that manifests in very different ways. But overall, if you have a headache, some difficulty to tolerate light and sound, and or nausea, and you're slowed in your activities, it's probably a migraine and not just a headache.
And what causes migraines?
So what we think now, scientists, is that it is encrypted in numerous genes. So the way your brain works is a very, very complicated software, if you can imagine. And in this software, it's determined by proteins. So channels, neurotransmitters, neurons, all the contents of the brain, it's how the computer works really. And depending on a bunch of genes, so we know more than 40 now that could be involved, well, then your software might have a migraine attack. So might be prone to certain triggers, might slow down, might have those temporary episodes of pain and other symptoms. So a lot of genes that modify how your brain software works.
Wow. So it's fairly complex.
It is very difficult to simplify because if you say, well, you have problems with your thyroid, it's kind of simple. You have, not enough stimulation and we'll give you some Synthroid and that's it. For migraine, there's the factors involved, the zones of the brain involved are so many that it's complicated. But then I used to say, the brain is electrical, it's chemical. So it's actually normal. We do not see things on normal CT scans and MRIs. But we know all of this because of other ways that we research migraine since the past decades. And that includes things that allow us to look at genes, proteins, chemicals, electrophysiology, and that kind of thing.
And not everyone will experience the same thing when they experience a migraine, correct?
That's true. So migraine is very diverse. It's extremely common, right? So 15% of the world's population lives with migraine. And that's more women than men and 10% of kids. And so you can imagine with all these people and all those genes, it's not always the same for symptoms, triggers, and also response to treatments, by the way, and overall prognosis. So migraine can vary from I have a few attacks per year, I take Advil and it's okay, to I'm bedridden, I'm on disability, I've tried 20 drugs, I've seen 3 neurologists. So it varies. The spectrum of migraine is very wide.
And what sorts of things can you do to treat a migraine?
So there's a lot of things you can do, and a message out there is if you live with migraine and your life is crappy and you miss on your life and your days and you struggle, there's a lot out there. So I always tell people, go to migrainecanada.org and look at our migraine tree or PDFs or podcasts or webinars. We have different formats for you to learn because the list of things you can try is very wide. But you can first do a headache diary. That's pretty much for everybody. And so we have an app, which is the Canadian Migraine Tracker, which is very useful. But you can do anything on paper as well. And then once you have a clear picture of what is your situation, frequency of attacks, severity, and so on, then you can decide to make maybe some adjustments to lifestyle that can help, sleep, exercise, dealing with stress, mental load. That's kind of a good start because it's good for your whole health. But then never forget, like, migraine is a neurological disease. So even if you have the most perfect life, you can still be disabled. And then you will need stuff to break the attack. We call those acute treatments. You take them as needed. And preventive treatments that will decrease the frequency and intensity of attacks. And now we have probably more than like 20 options for preventive treatments. If you include neuromodulation, supplements, medications, antibodies, Botox. So there's a very, very long list of things. And doctors cannot predict what's going to be good for you. So it's a path with trial and error. But at the end of the day, usually we can improve someone's situation significantly.
That's brilliant that there are options for people who are experiencing this.
Yeah, it's very important because people tell me two things when they arrive in my office. And they will tell me first, I feel very alone, which is weird because 15% of the population is like you, right? But
Yeah.
people don't talk about migraine because it's invisible, it's stigmatized. It has a long history of being, crazy women. It's on their head. All of this is changing now, which is great. So I tell them, you're not crazy. You're not alone. All the symptoms you described to me make perfect sense. Now for the plan, maybe you've tried a few things, but here are other options. And then we just walk the path and try things. And over a person's life, there might be moments where you try certain things and then, oops, hormones happen, cycles, accidents, medical issues, stressful periods. So it's really it's a bit like asthma. There are triggers, there are phases. So you have to kind of navigate your life. But luckily enough, now it's way better than it was like 20 or 30 years ago.
Absolutely. And is a migraine ever dangerous?
Yeah, people are often concerned because the pain can be severe and you can throw up and you can have this for days and days in a row. So it's certainly extremely disabling. Now, the good news is that it does not kill people, right? So there's no shortened life expectancy, for example. If you browse the internet, you will see things like increased risk of stroke with people with aura, especially migraine with aura in young women. You will see tiny risks of vascular issues, even some risk of increased dementia. But remember, migraine is so common, then those risks are very small. So at the end of the day, I don't mention any of this to patients because the risk is so small. And in any case, I'm going to take care of their global health. So I would say, no, migraine is not dangerous, but it can be extremely scary, especially if you have severe attacks, if you have weird auras where you paralyze or you lose your speech, or if you have vestibular symptoms, you get dizzy, vertigo. I get these and they're super scary. I mean, if I were not like a neurologist specialized and I didn't know what was going on with me, I would go to the Emerge for those. So it can be very scary, but it doesn't kind of leave lesions or things like that in the brain. And it's not associated with anything like brain tumors or things like that, for example.
Oh, good. Brilliant.
Yeah, that's good news.
Yeah, good news. And so Migraine Canada is releasing a short film tomorrow to talk about living with migraines and the experience it has on its family. It's really exciting to be able to see this.
Yes, I look forward. I'm actually flying to Toronto to attend and to collaborate to the panel that will introduce the movie and discuss it afterwards. The most important thing for people living with migraine is to know that they're not crazy and they're not alone. And a lot of them live with guilt and shame because they feel like they're weak, like it's their fault, like they're not doing the right thing. And they are told very often, oh, if you drink more water or if you manage your stress. But at the end of the day, no, you have a neurological condition. There are treatments that can make you feel better. And so it's the only way to break this guilt and shame that just adds to the suffering of migraine is to talk about it and to listen to stories of resilience, stories of trial and error, stories of success, and if stories that tell you that you can really find a better life. So I hope that more and more people will talk about it in different ways.
Absolutely, that they're not alone and there is support available.
Yeah, there is. Migraine Canada, we're very dedicated. So we work on different things to help people access care, get treatments covered, get information, reliable information, because there's a lot of disinformation out there and kind of, miracle cures. If anybody tells you that this is 100% good for migraine, just don't believe it. So I have to be careful. And so we provide this. We want to provide support and grow our community. So I'm very, very proud and happy to be part of this great team. And in June, which is the month for migraine awareness, we are running our Move for Migraine Canada event. So I'm going to do boxing for an hour for migraine. Yeah, fighting migraine. But you can create your own event. You can donate. You can support someone you know. And with all the funds, well, then we can make more projects and progress and create new programs for people living with migraine. So I'm very, very proud and happy to be part of Migraine Canada.
Yeah, sounds like it's going to be a great month. And good luck on your boxing match.
Yeah, absolutely. And just to say, I don't punch anybody on the head, and I don't. It's all about technique and training. No real combat here.
Yeah, I think for a neurologist, that might be a conflict of interest there.
Yes, totally. Hitting anyone's head is not a good idea ever.
No, absolutely not. Well, thank you again so much for taking out of your time out of your day to speak to us. We really appreciate it. And best of luck in these coming weeks. It looks like it's going to be a really great month for Migraine Canada.
Yes, thank you. And everybody, look up our website. Thank you for your interest, and never lose hope. There's always something out there that can help you.
Absolutely.